Now, the first question is, how can I prevent falls? Well, the way to prevent falls is to start preparing yourself, or let me rephrase that. The way to prevent falls is to begin well before you start having falls. And the thing that we think is important there is exercise. And again, exercise that emphasizes balance and emphasizes agility. Now, once falls start to happen, then exercise remains important, but there are other things that need to be done. And the first is that one needs to think about what are the causes of falls. And I generally think of three main causes of falls in Parkinson's disease. The most common are falls that occur as as a person gets out of a chair, or as they try to turn. So they're when it's changing the position of the body, and these can be falls to the side, forward, or backwards. A second common type of fall is one that occurs when the feet stick to the floor or freezing. So the person's body is going forward, but their feet don't move forward, and people fall forward onto their knees and onto their outstretched arms. The third type of fall is one that occurs when the blood pressure is low, and this fall may actually be a faint, or people are losing consciousness very briefly. Obviously, these three types of falls have different ways in which you try to manage them. The easiest is probably the falls that occur with the blood pressure being low. And oftentimes what the clinician needs to do is look through the medicines that the person's on, and there are medicines that will lower the blood pressure, and altering those is often enough. But there are other things that can be done as well. The falls that occur with freezing are very difficult to treat. One thing is to help people not be injured by them. So some patients find that putting on knee pads will protect their legs and, for that matter, their pants if they fall forward on their knees. Better control of the Parkinson's disease may reduce freezing and reduce falls as well. The other type of falls, and probably the most common, the ones that happen with turning and with getting out of a chair, are things that the physical therapist can work with the patient to find safe ways of doing those and to prevent falls. Walkers may also be very helpful for that. What about preventing falls? We've talked about exercise as being one way to try and prevent falls. Physical therapists can help with trying to prevent falls. The other thing that can be done is to look at the home, and are there loose rugs around? Can furniture be placed in a way that it can actually help people walk, such that they can put their hands on the back of a sofa or a sturdy chair as they walk through a room? And oftentimes we'll have occupational therapists go out to the home, look at it for safety, make recommendations. And the other thing that might be done, particularly in the bathroom, because that's a common place to fall because people are having to turn around, back up, move in a restricted area. And grab bars put into the bathroom are often very helpful for that. So occupational therapy can be very beneficial in trying to prevent falls. Finally, I think that nobody likes to talk about a wheelchair because that seems to be defeat, giving up. But many people say, I will never use a wheelchair, and the consequence is that the people stay at home. They don't go out at all. And a lightweight folding wheelchair often gets people back out into the community. They go to movies, they go out to restaurants and so forth. And so I think the use of a wheelchair to get out into the community is often very helpful for somebody that has poor balance and cannot walk any distance safely. So in Parkinson's disease, as the disease progresses, walking becomes more difficult. And one of the consequences of that is that people have to pay more attention to walking, where they're going, and anything that is distracting from walking will be a problem. So sometimes if you're walking with friends or family and they're asking you questions and trying to talk to you, you have to tell them that this is not a good time to discuss things, because that distraction will often lead people to fall. Another problem that will lead to falls is trying to carry things. So you want to be careful about trying to carry a number of things. A third problem, if your balance is impaired, is bending over to pick up things. And you need to be very careful, or let somebody else do that. Or this is where the occupational therapist often will give you tools that will allow you to pick up things without having to bend over. So bending over is a common cause of falls as well.